Today's webinar will look at a topic that has come up frequently in previous webinars, the need for comprehensive registries that can track patient data to assist researchers and clinicians. We'll discuss the critical factors in setting up these registries, best practices for collecting and maintaining the data, and how successes can be replicated around the world.
A registry is an organized system, well-organized system, in order to collect standardized information on a group of patients with specific diseases or a condition. Traditionally, they are established by research institution, academics, but now, since several years, to tell you the truth, also they are established by patients. The objectives of the registries are wide. It depends. First, they should collect information, for example, to study the natural history of the disease. They develop research questions in order really to push research. They monitor safety of drug, or for example, they develop standards of care and monitor also and improve quality of life of patients.
So biobanks collect biological material from patients that live with a rare disease. And of course, this biological material needs to be associated to data that are as accurate and as complete and as standardized as Domenica mentioned for registries. Biobanks are a fundamental resource for research on rare diseases because due to the rarity of patients, being able to conduct research on the actual biological material is really challenging, especially for some ultra-rare disease. And so the underlying principle that internationally the community is trying to adopt is to make biobanks internationally accessible.
That story of each of your individual experiences for each patient and their family, we then allow the questions that we're asking to be asked for each other person involved in that registry. So compiling that all together allows us to then get a sense of really how disease progresses in its natural state for everyone that has that over time. And again, Peter mentioned many different ways that we can start to structure and standardize that. This adds together into our body of knowledge that researchers can then start asking questions such as, if they eventually are aiming towards a treatment, what is the difference that would happen with this treatment compared to what normally occurs if you don't have a treatment for that disease?
So in general, it's a rule that the more data you have, the more power the statistics have. But rare diseases by their nature are rare. And so typically you have many smaller studies with 20 patients, 50 patients or less that barely are enough to get statistical power. And so one of the goals, I think, moving forward is to combine the results of individual studies. You have to use comparable outcome measures. And just as an example, when you give a patient with, let's say, a muscular dystrophy, a treatment, you're not measuring, do they get better or not? You can't really measure that. You have to measure something specific. And so, for instance, you could measure how many meters can a patient walk in 6 minutes, or you could measure how long does it take for a patient to walk 100 meters. They sound like they're the same thing, but it's not possible to just combine data from that are using different measures like that.